Hey guys, thank you for watching my videos. Today I'm going to talk about the pros and cons of being a surgical technologist. So if this is a video you're interested in, please keep on watching, and I would appreciate a subscribe, like, or comment. That would be very helpful to let me know that you guys like my videos. Alright, so let's start with the pros, and number one would be stability. Always be mothers that will deliver babies. There will always be some type of accident, trauma, broken bones, from older people to kids. There will always be some type of accident, and if it requires surgery, then you are in demand. So the next one is career opportunities. If you decide that you want to expand your knowledge as a CST, you could go for CSFA, which is Certified Surgical Technologist First Assist. You need a certification for this. You could either vote to have your associates with it or just certification. The certification is less than a year. Look into their programs of all these schools around and see which one would be better off for you. And then if you want to expand even more, then you could go to physician assist, and that one you need a bachelor's degree because PA is actually a master's degree. And then if you really just want to be up there, you could go for your nursing license. So then you could be an RNFA or you could be a RNPAC, and that's when you start really taking care of the patient. Alright, so the next one would be the money. Now, the minimum wage for surgical technologists varies per state. So the minimum for California would be different in like Tennessee or Maryland or something. It just depends on the cost of living and obviously your experience. But I'm going to assume that the people that are watching my videos are students and never had any experience. So I am going to give you an advice and go on, I guess, salary.com or something and figure out what is the base pay for CST in your city and state, because I can't really give you exactly, but I know that when you start with no experience, there's very little bargaining chips to get up there, but there's also opportunity to get up there once you have at least a year experience. So once you get your job, you have so many opportunities to pick any specialty that you want. And there's only a couple specialties that actually make money and look very good on your resume if you decide to move around your city or around the country. One of them is orthopedic. Now, on your clinicals, you might hate orthopedic because it's literally carpentry. It's all drills, saw, drill bits. It's just, to me, personally, it's just a manly thing. I have never ever even lifted a drill in my life until I got into this field, and I absolutely hated it. Okay, but there are some people that do like it or have no choice but to like it because it makes money. Okay, so when you go to clinicals, make sure that you always pick ortho, because that's gonna catapult you to a lot of things. Okay, ortho. Hearts, you cannot get into hearts immediately after school because just people don't hire straight off school techs. You need some type of experience, maybe 1 year or 2, and then you start asking for heart experience. 3, neuro and spine. I'm not really that good in neuro and spine, and not because I just suck at it, it's just they never gave me the opportunity to learn it. Every time I ask, it's always so busy, so there's nobody to mentor me. So I wouldn't say I'm good at it. I just wish I learned a little bit more, but the hospital I worked at didn't have enough neuro and spine for me to practice. So if you're in your clinicals and it is a heavy neuro spine cases, pick that one too if you can. Write notes. Make sure you write everything and anything and retain everything that is in there that you have learned from the techs, from the doctors, from the nurses. Legit, I'm telling you, the best advice to just write it down. Other specialties that are specialty, but I don't know if they're gonna pay more in other hospitals, because there's a couple hospitals that pay, sometimes don't, but it's good to know that you have it on your resume, and that is robotics. More and more hospitals are implementing robotic surgeries. A couple of my hospitals have them, and it's nice to know how to operate these robots, and it looks really, really great on your resume. So again, on your clinicals, if you do happen to have a robot, then go pick that one. You will like it. I don't personally. I know how to do it. I don't like it. It's just too much sitting down, and it's just not my thing. So yeah, so those are the top 3 main specialties that I want you to fully immerse yourself. And lastly, there is a lot of shifts that you can pick from depending on what the hospital needs. There is 5/8s, there's 4/10s, 3/12s, and obviously night shifts in other hospitals. So depending on your flexibility and depending on your lifestyle, family, kids, or whatnot, there are lots of shifts to pick from. So that's great if you want a place that is very flexible. So that's a great opportunity. Okay, so let's talk about the cons. There's always cons in everything. Let's start with number 1, calls. Every facility has calls. If you work in the main OR, there will be calls. So I hate calls. I don't like it, but some people love it because it gives them opportunity to make more money, right? So for people that don't have kids and the people that are money driven and have nothing better to do but just want to work and work and work, this is for you. But for me, I consider it as calls because I do have a life outside of work. I run a couple businesses, so it gets really heavy when you have calls. So how calls work is that you do your regular shifts. Let's say you work 4/10s, 4 times a week, 10-hour shifts, and they assigned you a call. This may be a little different in any other facilities out there, but the way that our call works is 12-hour shifts and 24-hour shifts. So you have to be available for those shifts. And when they call you, they give you 30 minutes to get to the hospital, and you have to be there with a team, nurse, anesthesia, the patient, and you. You have to pull your own cases, you have to pull your own preference card for this doctor, and you're just kind of on your own sometimes, you know? So if you're new and you just got off orientation and you're now taking calls, it's a bit difficult because you don't know where things are. And I struggled with that, but good thing I had a really great mentor and I was able to just pick up, you know? But definitely calls could either be a pro and a cons, but for me, definitely cons, because I always get a heart attack every time I just close my eyes when I'm trying to sleep, and then boom, 2 a.m. they call you. And I live pretty far from the hospital, so if there was some type of subdural hematoma that needs to get done and they want you to be there quick, as if I have a jet that you could just go there, you know, it's difficult. And also, I wanted to mention that they could also cancel your call in the middle of your drive. I've had that happen to me once. I was literally about to sleep. I closed my eye for just a little bit and my phone rang and my heart dropped because they're saying it's a subdural hematoma, so I had to be there. Halfway through, they told me I'm canceled because the patient died. So I don't get paid for that because I didn't clock in. So it's not good. Not good for me, not good for my car. Okay, so let's move on to the next one, which is this field will definitely take a toll on your body, because not only you stand for long periods of time, you also lift, you pull, you push. I mean, I know that we use these things to lift patients, but when you constantly have to do heavy cases, it really takes a toll on your body. If you've seen my previous video, I'm wearing a back brace because I've hurt my back once and I don't ever want to injure myself again. So you have to prepare your body for this. It's not for the weak. So take care of yourself, okay? And always protect your body, because if you get injured, you're gonna get replaced the next day. So that's just the realest thing I have to say. Speaking of rough on your body, it's also high stress level. You're never always gonna have a really smooth sailing day. It's always 50-50. It's always so busy, and sometimes it's just super dead, right? So you have to be really prepare your mind and body for this, especially if you have calls. So this field is also fast-paced, right? So as you can see in my other videos, I would do 3, 2, or 1 case a day. But there are days where I just couldn't film because I'm doing like 5 cases, and these are not easy cases. They're like back-breaking cases. So again, you have to prepare yourself for that. Get good shoes. I'm wearing Danskos. I don't know if they're helping my back, but you need good shoes. You need the one that has steel toe, because Those operating room beds are not a joke. You could hurt yourself and it hurts. It hurts. Wear good shoes, not running shoes, not the one that has mesh in them, because you're gonna have these blood all over you, so it's disgusting. Please don't do that. Speaking of stress level, sometimes you don't really get to eat. Sometimes you don't get to pee because there's nobody that could relieve you. It's just so busy. So I will make another video on how I prepare myself for my shift, because I definitely have developed some type of plan. Okay guys, that would be it for today. Thank you guys for watching this video. I hope you learned a couple of things. If I forgot something, please comment them down below. I'm losing it. Thank you guys for watching. I really appreciate it. I hope you guys like this video. I will see you guys on my next one. Bye.